Hey everybody, welcome back to my channel. Today I'm going to be giving some tips on how pre-nursing students can prepare for nursing school. I get this question asked a lot, so I thought I'd just make a video of it. If you are new to my channel, make sure to give it a like and subscribe. Also, never miss another one of my videos again. All you have to do is hit the bell down below. And with all that being said, let's get started. So you're thinking about going to nursing school. Congrats on your decision. Nursing school is a great place, especially if you know how to maneuver it. So you're thinking about going to nursing school right now. You are probably doing your prereqs. So what are some tips that I can give you? Some tips that I can give you is, first off, the first major tip that I can give you is knowing how to study. I know you're doing your prereqs right now and you're probably taking some English courses, some math courses. Some advice that I can give you is try to figure out your study habit now. If you understand how to study first, nursing school is going to be great. Although your prerequisite nursing exams and your nursing exams are going to be completely different, by the way. So I'm letting you know right now. But as long as you have the determination within your mindset and you have the perseverance, you got this. You're going to do amazing in nursing school. So first tip, remember, understanding your study habits will take you a long way. That means learn if you like to do note cards, if you like to do study sheets, if you like to work on the whiteboard to study, whatever you like to do, figure it out now. So by the time you go to nursing school, it at least gives you that first step of preparedness so you can study. Although studying for nursing is different because a lot of it is not memorization based. A lot of nursing is concept based, meaning you need to understand the concept behind the disorder in order for you to pass your exams. And when you enter nursing school and you want to know how to study for nursing classes, check out the link above. Check out that video. It helps you significantly, especially within nursing school. The second major tip I can give you is studying extremely hard for anatomy and physiology. A lot of nursing school is understanding the body and what the body does. So by you understanding the anatomy of the body, let's say cardiac, understanding all parts of the heart and what the physiology behind it is, it makes pathophysiology within nursing school that much better. So by understanding the anatomy and physiology of different organ systems, it's going to give you that advantage. So be strong in anatomy and physiology. If you are good in patho, you're going to be good in pharm, because all pharmacology is understanding the pathophysiology of disorders so you can treat it. So if you understand the patho, you will understand the pharm. Another major tip that I can give you is figuring out certain life circumstances before going to nursing school. So for example, if you're struggling financially, figure that out now, so by the time you go to nursing school, you don't have to work as much hours, so you can just be focused more on your studying. If you, for example, maybe you don't like where you're living, figure that out now before going to nursing school. Pretty much my main point is figuring out life circumstances before going into nursing school, because I've seen a lot of people, other programs, that people had a lot of issues in their own life. Students were unable to focus on their material because they had other life circumstances going on. Maybe they had to work more hours during nursing school, or maybe they had some family stuff going on. But whatever it may be, try to figure as much of it out as you can before going into the program, because life issues can be very taxing. So it's important for you to figure out those issues now so you can feel more comfortable during the nursing program. And you don't want to struggle within that year and a half to 2-year block. So it's better if you figure things out now. Another advice that I can give you is, if you really aren't too aware of medical terminology within the nursing field, or the medical field, I would definitely say if you have the chance to take a medical terminology class, I would say you should take it. Because medical terminology helps with the prefixes and the suffixes of certain words. By you understanding certain medical jargon and some nursing terminology, it really does help you a long way. Medical terminology does really help you in the long run. It puts you in that healthcare nursing mode before actually being in the nursing program. So if you want to really understand the terminology within the medical field, definitely take medical terminology because it really does give you that advantage. Also, if you really want a taste of what nurses do on a daily basis, but you aren't a nurse so you can't work, so what are some options that you can do to get a job in the hospital? Well, if you are planning on going to nursing school and you really want to get some experience before becoming a nurse, I suggest you to possibly get a job as a CNA, or in some hospitals they call it a PCIA. What this does for you is that it allows you to learn a lot about what nurses do on a daily basis because you are actually working alongside the nurse within that 12-hour period. And mainly what you're doing is taking vital signs, you're doing AccuChecks, you're providing patient care, you're turning patients. If you want more in-depth video of what CNAs do, I'll leave a link above here so you can check it out. Another tip I can give you if you are planning on going to nursing school, and let's say if you're at a university right now and you're going to transfer into the university's nursing program, I suggest you to get an extremely high GPA before going into that program. The reason why I say get a very high GPA before going into the program is because nursing typically does drop your GPA. I'm not gonna say that you're gonna fail or anything like that. I'm just saying that typically on average students do get range from that C to B area within nursing because of how incredibly taxing nursing school could be. I'm not saying that you can't receive an A, but my whole point of this tip is that by you having a high GPA, it gives you that fluff that you need. Let's say if you do get a C in an 8 credit hour class, that C is gonna drop your GPA probably by like 0.3, and that's very significant in a nursing program because nursing programs require you to meet certain standards. So if your current GPA falls below a specific GPA that you're supposed to maintain, that puts you on academic probation. And the reason why academic probation is difficult for a nursing student is because sometimes the school may require you to utilize extra resources. Program may place you in a extra class to know how to learn how to study. So pretty much my main point is that if you have a high GPA going into the nursing program, it pretty much fluctuates your overall, it gives you that fluff that you need to maintain the GPA so you can just graduate and become that nurse. So hopefully you enjoyed the video. If you did, make sure to give it a like and subscribe. Also, if you found it beneficial, make sure to send it to somebody who's planning on going to nursing school. And with all that being said, thank you for watching. Have a great day, and Tribe Nursing signing out.